Action Plan for Charleston County Public Library, McClellanville Branch by Shannon Ullery Bales, Megan Corwin, and Jennifer Ring. McClellanville, South Carolina is a community of 605 people in 222 households. 98.5% of the residents speak English at home. The estimated median household income in 2021 was $106,000. 6.3% of residents currently live in poverty. For the population 25 years and older, 97.2% have achieved a high school graduation or higher. 0.9% are currently unemployed. McClellanville residents generally have a very high functional literacy rate. 100% of residents in the 18 to 24-year-old range have a high school diploma or higher. Residents 25 years of age and older have a 97.2% rate of high school graduation, with 57.7% obtaining a bachelor's degree or higher. The residents' technology access could be improved. Currently, 250 of 264 households in 2021 had one or more types of computing devices. 209 households had broadband internet service, and 55 of those households only had a cellular plan. The initial community takeaways is that McClellanville is 100% rural. The town houses the smallest of all the Charleston County Public Library branches. 100% of those that live at the poverty level are African Americans, the majority of whom are children ages 6 to 17 years old. And the high school age students of McClellanville do not go to school in their town, and they must travel more than 30 miles to attend the Wando High School, and technology needs in the community are very present. The McClellanville branch of the Charleston County Public Library patrons are mostly seniors and children. The patrons are either, quote, extremely loyal or just passing through, according to an interview with the staff. The most popular resources are technology related, with locals wanting internet access and people camping in or passing through the area and using the computers and the internet. Some statistics about the McClellanville branch are that it has 4 staff members. It is 1,280 square feet, which makes it the smallest of the branches. It is open 4 days from 9 to 6, 1 day from 2 to 6, Saturdays 9 to 1, and it is closed on Sundays. It houses a collection of adult and children's fiction, nonfiction, DVDs, and audiobooks. It has a limited older collection. The need is present for newer books. It has a very small young adult section and even smaller large print selection. Most popular resources continue to be computers and Wi-Fi hotspots. There is a renovation planned to begin in January of 2024. The McClellanville branch has some popular current programs that include children's story time every week, puppet shows in the summer, nature talks, adult craft programs, and history talks. They are currently partnered with the Forestry Service, local schools, and most recently the Sheriff's Department for programming. The Wellness in Southeast Carolina Telehealth Network representative comes Mondays from 11 o'clock till 2 o'clock. COVID-19 test kits and blood pressure cuffs are popular items for the WISE telehealth representative, and they also distribute many informational pamphlets on topics such as diabetes, mental health, and nutrition. There are some occasional food programs such as the summer snack program with the food bank and other unofficial produce programs housed at the library. Our community analysis conclusions were that the McClellanville branch currently provides many essential services to its community. Most requests of the staff are for more technology resources and programming, with healthcare resources and functional literacy resources second and third priorities in the eyes of the staff members and the patrons. McClellanville branch's greatest needs are physical resources such as computers, blood pressure cuffs, more Wi-Fi hotspots, and more programming in the health and technology related classes. The structure of the branch itself limits their offerings in terms of size, staff, and hours. Many issues stem from decisions made without input from McClellanville staff and patrons, according to the staff. We see McClellanville branch's three greatest needs as more technology resources and programming, more accessible health literacy resources and programming, and more basic functional literacy resources. Some technology challenges are that the patrons need frequent technology help. The patrons enthusiastically participate in technology classes when offered, and they want more classes. The available internet in the local area is not reliable. Many people cannot either afford reliable internet service or live in an area where these services are not available. Many people come to the library solely to use the internet. The mobile hotspots are very popular and widely circulated, and the patrons want more. Many patrons sit in the library parking lot after the library closes just to use the internet. More challenges include low staffing and lack of resources provided by the Charleston County Public Library system as a whole, and that the McClellanville staff consists of new library associates and assistants with limited technology training and limited capability to help patrons with complicated technology questions. Our plan is that they update and increase their computing technology at the branch and increase internet capabilities in-house. We would like to see them increase the number of mobile hotspots available for checkout. One idea would be to have technology librarians visit the McClellanville Library in a similar fashion to their WISE representative visiting the branch. We would like to see the CCPL grant from the Public Library Association that is to provide digital literacy skills training and cover the costs of workshops in basic technology skills, including topics such as internet use, video conferencing, cybersecurity, mobile device basics, and information about the Affordable Connectivity Program that is currently offered at other branches. The outcome would be that these actions collectively would ease the technology burden on the staff and increase connectivity for the community. We could measure that by taking a detailed current/before survey of staff and patrons, and then survey 6 months after renovation and increased technology resources plan to see the increase in satisfaction. Number 2 need would be the health literacy resources and program. Their challenges there are that the largest health literacy partnership, the WISE Telehealth Network, is set to end services in 2024. This means that the popular blood pressure kits will not be available any longer, and the other WISE health resources will not continue. And another challenge is that the Charleston County Public Library system does not include McClellanville in after-school snacks and meals through their Kids Cafe program. The plan would be to conduct a meeting with the WISE representative and McClellanville's staff about times when health literacy visits might be most beneficial to their patrons. We see that the community healthcare worker is not present during story times to give families access and exposure to the services. They are also not available after school for teens and young adults, or during after work times for the employed adults and unemployed adults to benefit from the health literacy resources. We would also like to see the Charleston County Public Library expand the after-school snack and meal plan through their Kids Cafe program to include the McClellanville branch. The outcome would be continued and expanded access to health literacy and healthy programming for the community. We have a recommended partnership to either supplement or take over as the partner for health literacy resources in the form of the St. James Health and Wellness Collective, which is right in McClellanville. Its mission is to serve the underserved, and we believe that it would create a closer, more consistent partnership since it is so close to the actual physical branch. And it is truer to the values of McClellanville. Um, their values are working with locals to solve local problems. And thirdly, functional literacy resources. The challenge is that the collection is small, old, and limited for young adults and large print. The plan would be conduct a collection analysis and weed accordingly, then perform collection development to serve its current community, potentially partnering with other nonprofits to buy new books or looking for grants that could help fund new collections. The outcome would be continued and expanded access to functional literacy for children, teens, adults, and the elderly. You measure that by assessing the circulation numbers regularly. Some notes on universal design and equity of access. We believe that change must start in the physical library space. Universal access features make the technological environment easy for all to use, including people who have vision impairment, are deaf, hard of hearing, or have a physical or learning disability. Our plan would include wider aisles to allow for patrons with mobility aids to safely get around, which is potentially covered in the renovation. More private areas for patrons with sensory sensitivities, potentially covered in the renovation. Large print collection for older adult community or those with sight disabilities. Increase the library signage using document accessibility strategies, and at least one accessible parking space, easier to navigate ramps, and an automatic door.